Assalamu alaikum. I'm Dr. Tahira and you're watching program Health is Wealth. Imagine a world where we can't hear anything or we can't smell anything or even swallow or speak. That is how important ENT is for us. So today we are present at the clinic of Dr. Junaid Shahzad, ENT surgeon, where he'll be talking all about you need to know about the ear, nose and throat and how you need to take care about it. Keep watching. We are talking about the ear, nose and throat, and as you know, the monsoon season is out there and there are so many infections of the ear, of the nose and the throat, and that is why we have with us ENT surgeon Dr. Junaid Shahzad with us. Thank you so much for joining us today, Dr. Junaid.
Welcome.
So the season is of monsoons these days, and there are a lot of people coming up with infections of the ear, especially since they take, they're swimming and they go to these different kind of water bodies, and children who are at home. So what do you have to say about these recurrent ear infections? How many types of ear infections are there and what happens?
There are basically three types of ear infections. The infection of the external ear, middle ear and inner ear. But as you are mentioning the monsoon season, in this season the external ear infections are very common especially due to the swimming and high rate of humidity, and this causes the ear infections very commonly. And one of the reason of the ear infection commonly is that after the swimming or taking bath, people use these cotton buds or they put something inside to remove the water from the ear.
So what do you tell children or people who are going for swimming or even bathing? How do they need to protect their ears, number one? And number two, if the water does get in, then what should they do?
As for the normal person, he doesn't need to take care of the ear as such. But in the ears that already having infections like in middle ear infections, there is a perforation in the eardrums. We ask them to use the ear plugs in the ears, the ear plugs that the swimmers use for before taking bath. And in the normal people, we ask them to don't to use any kind of things like cotton buds or putting finger or pins inside the ear to remove the water, because the inner ear, the external ear layer is made up of the wax, and it repels the water outside. So naturally the water will come out after half hour or 1 hour. So you don't need to do anything or put anything inside the ear to remove the water.
So we should not be using earplugs in general, that is what you're saying,
Yes.
but you should use it in case your ear is infected, or you use the normal earplugs that the swimmers use. But
exactly.
what if somebody does not have those earplugs, then what should they use? Can they use like cotton, or what should they use to block the ear if they are going for swimming and they want to protect their ear?
As for the swimming, they should use the earplugs because that is very important.
But everybody doesn't have access to it.
If doesn't have, then they should wear the plastic caps or like them. But as for the cotton, that should be only used in regular baths, because in the swimming water will go inside if even you are using the cotton plugs, because cotton will absorb the water and it will go. In taking general showers, then you can use the cotton with the Vaseline or oil over it, and you can put that cotton piece inside the ear.
And what about children? We keep giving the bath to the children, especially if they're neonates or very young children. What is the ideal way to give them a bath, or to wash their head in a way, or wash their ears so that the water doesn't get inside?
Yes, in the children's, first of all, there is no need to worry about. But if you are feeling that your child is having more dryness in the ear, or he is having some infection in the ear, then you should protect the ears similarly as in the adults, and you can avoid using the head wash also.
Okay, and what about otitis externa? When we talk about the external ear infections or problems of the external ear, what are the different problems that people can face in this outer ear? Okay. Let's start with that and then we go step by step.
Yes, exactly. In the external ear, first of all, as we have mentioned, the otitis externa, that is the infection. Infection can be bacterial infections like simple pimples, boils in the ears, and others are the otomycosis, which is a fungal infection. And this fungal infection is especially very common in this humid environment. Currently in this month of July, August, we face as many patients who are suffering from the otomycosis, the fungal infections.
And how do they catch these fungal infections?
Fungal infection is mostly due to the use of the cotton buds. And as you know that in the humid environment is very good for the survival of the fungus.
They keep thriving there.
Yes. That's why in this humid environment you should avoid the water entry inside the ear, and you should avoid using the cotton buds also. And especially in the fungal infections, the patient feels too much itching in the ears. That's why they again and again use the cotton buds.
Okay.
So for that they should consult the doctor, and we prescribe them medicines which decreases the itching also and decreases the fungal growth.
Okay, Dr. Saab, can you please explain the difference between an itchy ear and a painful ear? Because a bacterial infection would make it red, painful,
Yes.
inflamed, and a itchy ear would mean that it is fungal.
Yes,
So
sir.
is there any discharge with the itchy ear, number one? And number two, a lot of quacks out there are prescribing steroids for fungus, for example,
Yes.
which is extremely contraindicated. So could you tell and stress the people on not to visit quacks and visit a proper ENT surgeon so that they don't lose their eardrum and get into all of that?
First of all, in the discharging ear can be due to the bacterial infections, and also when there is a perforation in the eardrum.
Okay.
If the eardrum is damaged, then it can lead to the discharging ear. In the normal fungus ears, there is usually no discharge. There is too much itching in the ear, and sometimes, very rarely, it causes the pain in the ear. But the main symptoms of the otomycosis fungal infection is the itching in the ear. If you are having the itching too much in the ears, you should consult the ENT specialist. So he can prescribe you antifungal drops, and along with that he will prescribe you a few antihistamine medicines to decrease the problem of the itching.
Okay, they say that we should not be using these pens and bob pins and everything, inserting in our ear. But then a lot of people, when their ear is itching, they start using
Yes.
this. And then a lot of people use each other's hands-free or headphones and all of that. So what is the role of continuously using Bluetooth or any sort of ear devices?
In the new recent researches, they say that the plugs in the headphones or the Bluetooth devices, they contains many thousands of bacteria that can cause the infection. If you are using too much loud noise, music on that can damage your inner ear. But on the medium or low volume, it will not cause any problem in the inner ear.
But infections, yes. So
But
you have-
infection, yes.
So
So
you
you should always try to clean your earplugs, the plastic or the rubber
Okay.
plugs in the Bluetooth
and not
devices.
use each other's
Yes,
also.
and you can also use spirit or alcohol swab to clean them.
Okay. So this was about otitis externa. What about otitis media or the middle ear? We've heard that the middle ear and infections of the middle ear cause like 60% deafness in 60% of the population. So what are these middle ear infections? How do you catch them and how do you go about it?
Basically, in the middle ear infections, the most common reason of this is usually the nasal infections. The nasal sinuses infection or throat infection, especially in the children, they leads to the infection in the middle ear. And other causes, rare causes, can be the trauma to the ear that can cause the burst in the middle ear, or traveling, frequent traveling. It can also
the pressure difference in traveling.
differences, it can also lead to the middle ear infections. And the middle ear infection, the most common symptom in the start is that patient will feel severe pain in the ear, and after that he can feel the discharge from the ear, the pus discharge or bloody discharge, and later on he will not suffer from the pain but decrease in the hearing.
Okay. So what? How do you deal with a middle ear infection? Because there are the terms like glue ear, for example, middle ear with effusion, or is there a chance of getting perforated that the membrane? And when we go to some doctors, they say there's a lot of pus and we need to drain it ourselves. We are going to do myringotomy or whatever it is called. So what is that all about, and should we go for it or not?
Yes, that is another entity of the middle ear infection.
Okay.
That we call effusion in the middle ear, and which is very, very common in the children especially. Basically, the mucus inside our throat or inside our sinuses, that goes inside the ears, and because there is a connection between your nose and ears, that is called the eustachian tube. When the eustachian tube is blocked, which is very common in the young children's, and especially in the people who travels by air or who goes to the mountainous areas frequently, that can lead to the blockage of eustachian tube, which causes the fluid retention inside your middle ear. That causes conductive hearing loss in the patients. So that's why we ask the patient to go for the myringotomy. In the myringotomy, we make a very small, precise cut in the eardrum, so we can drain that fluid out. And after the myringotomy, that cut
It
over,
repairs itself?
It will drop itself.
And what are the threats to an eardrum? How can an eardrum be perforated? That they keep saying, don't do this, don't do that, you might rupture your eardrum. What are the ways you can rupture an eardrum?
In acute otitis externa, it can cause the eardrum infections.
Okay.
So whenever you feel severe pain inside the ear and blockage in the ear, you should always consult the ENT specialist. So he can prescribe you timely antibiotics and painkiller decongestant, so you can prevent that ear perforation.
Okay.
And the other common causes are again barotrauma,
The pressure
differences, and the slap trauma. Slap trauma
so you
is
should not be slapping the children very hard.
very
It can
hard.
actually damage their ear.
It can also damage the middle ear. And especially I will like to mention that if you have a slap trauma or trauma, any kind of trauma like ball hits, and it causes the eardrum perforation, do not put anything inside the ear, because it will cause when the eardrum is damaged, there will be a bleeding, and there will be a clot formation. That clot formation is very important for the healing of the eardrum. So if you put inside like oil or garlic oil or anything oil or any drops,
it will hinder that process. And even putting in some steroid drops will also hinder
that.
Okay, what about foreign bodies? A lot of children, especially while they're at home, they like to stick in things, beads and different kind of things inside the ear, and then insects also get into the ear, and so much so that in Urdu, in fact, we call that insect with the name of the ear, that it goes into the ear, the centipede. So how do we deal with insects going into the ear or foreign bodies going into the ear?
In this season, monsoon season, the insect foreign body is very common, because most of the people, especially in the villages and towns, they sleep outside of the house, and there are the insects which flies in their ears. So whenever there is an insect or any living foreign body, mosquito or fly gets inside your ear, do not panic. Do not put anything like cotton bud or any pin in the ear. Just put some oil, or you can put any ear drops in the ear. That will lead
drown the insect?
Yes, to drown the insect. And that will suffocate the insect and he will die. And then after that, next day or day after tomorrow, you can go to any ENT specialist and he will remove
But we should always not try to do it ourselves, because we keep pushing it inside, right? Only you can remove it with some instrument or device.
But if there is a delay in the removing of the insect, don't panic. Just put something inside your oil. If you not have approach to any ENT specialist, you can wait. But do not anything probe inside the ears. And in the other foreign body, like in the children especially, they put some beads inside the ears, or sometimes rubbers, plastic inside the ears. So in that case, I also advise the parents to do not panic and to not consult any quacks or any other physician in that, because ear is very sensitive part. You should always consult ENT specialist. If there is a delay for even for 1 week, if you cannot consult then there is no worry about it. If the foreign body inside the ear,
let it stay, but don't push it. What if somebody does get a rupture? There is a rupture, and that there is a perforation or whatsoever. So is there any procedure to repair that perforation?
First, we advise the patient to keep the ear dry, or if there is infection or pus coming out of the ear, we advise the patient to use any antibiotics drops, and it will lead to the dryness of the ear. Once the ear is dry for like 3 to 4 months, and then there are 50 to 60% chances that it will heal by itself. If there is a perforation is not healing after even 4 to 6 months, and ear is dry, then we go for the surgery, which is called meningoplasty, in which we repair the tympanic membrane.
And there is no problem with it, no side effects, it gets repaired.
Yeah, it gets
And there is no precautions after that as well?
No, there should be a precaution like 2 weeks to 3 weeks. Patient should avoid the water entry inside the ear, and he needs bed rest for almost 4 to 5 days.
What about the internal ear? What are the problems of the internal ear? And a lot of people complain of these balance problems and vertigo, and their head starts spinning. Is it related to the internal ear, or what is related to the internal ear?
Vertigo is mostly 90% of the causes are caused due to the internal ear problems, because in inner ear we have two systems, the hearing system also and the balance system. So in the balance system is controlling your balance in the walking, on sitting, it controls the balance system. So whenever there is a problem in the inner ear, any kind of infections or trauma, that can lead to the vertigo balance disorders.
So how do you know that the problem is actually from the internal ear, and people usually prescribe just a medication, just a tablet for vertigo? Is a tablet enough, or do they need to get some internally assessed or manipulated for that?
For the vertigo, there is a list of examination we do perform on the patients, and after that we come to know that he is having a central cause over the vertigo is due to the ear. Okay. But as I mentioned, that 90% of the cases of the vertigo are due to the inner ear issues. Okay. So in the inner ears there are multiple causes of vertigo. Once we diagnose the cause, then we can go for the treatment. And in every vertigo treatment, you don't need to give the patient medicines. Okay. There are few also exercises that can reduce the vertigo.
So would you mention a few exercises, because it's a very common problem. Yes. A lot of people have vertigo while traveling, while otherwise. So what are those exercises?
These are basically play maneuvers, and you can get them from the YouTube also. There are many videos available on the vertigo, also in the Urdu language and English language, that by performing these exercises at home, you can relieve your vertigo.
Okay, and what about when we are going up, when we are ascending, whether we are hiking or we are going on a higher altitude or flying, and then our ears start really hurting? They say you do this maneuver and it helps you, your ears won't close, won't block, so that Valsalva maneuver and all of those. So what do you suggest if somebody is going and it starts hurting their ears, and especially children? Should we feed those children at that time, use a chewing gum, do what?
Yes. Using chewing gum is very helpful, because it will cause the opening of the eustachian tube, which is the connection between your nose and the ears. As we move above from on the high altitude or in the aeroplanes, that causes the pressure on the ears. To relieve that pressure, we need to open eustachian tube. So using chewing gum, bubbles gum, or feeding the babies, it is very good to open the eustachian tube. And also good hydration. Taking lot of water.
And what about the angle of feeding the baby? Because a lot of mothers keep them flat or put the bottle inside, and that causes the infection. Yes. So what would you suggest to them, that how do they place the baby while feeding so that it doesn't leak?
Baby head should always be elevated from the body, because in the babies, the nose and the ears are on the same levels. And that's why the milk drops can go to the ears, and that can cause an ear infections.
So it is very important to keep it.
And also after the feeding, you should tap on the back of the child.
And make sure that it's not there. Yes. Okay, and what about, we talked about all these infections, and we don't take it seriously, but almost 700,000 people die each year around the world just due to otitis infections, right? So what about hearing loss? How much of hearing is affected, and due to what reasons, and what kind of infections, congenital or otherwise, can cause hearing loss, some metabolic problems? What are the different reasons for deafness, and how do we control them?
There are two kinds of deafness, mainly sensory neural hearing loss and conductive hearing loss, and there is also a third entity, we call that mixed hearing loss. Sensory neural hearing loss is usually due to the inner ear infections or the nerve damage, and it is mostly common in the adult old age patients. We call that presbycusis. After the 60 years, every human being is having a deterioration in the hearing. So for that, we advise normal people to use take multivitamins, and also keep the good diet, and you can use the nuts for improving your hearing also. And sensory neural loss, very common cause nowadays, is the congenital hearing loss. And the congenital hearing loss, as you can see, there are many children we are having with the deafness.
Yes.
Okay. So for that we use hearing aids or cochlear implant. And the other hearing loss is the conductive hearing loss. Conductive hearing loss is due to the infections in the middle ear, as we have already mentioned, and most of the people having the conductive hearing loss are due to the perforation in the tympanic membrane.
So conductive hearing loss can actually be repaired, it can get better. But if somebody is born with congenital hearing loss, either due to, if the mother had infections like they say syphilis or whatsoever, or there are different kinds of syndromes like these Alport syndrome or these syndromes that cause a deafness. So what is the hope for them? What is the hope of these cochlear implants? How expensive are they? Can they actually expect their child to hear after that? Because speech and hearing is also related. So do cochlear implants help, or do the traditional hearing aids help?
Yes, because in the children's we first of all assess the child how much hearing loss he is having.
Okay.
If he is having, like for example, moderate to severe hearing loss, he can listen with the good hearing aids.
Okay.
But if he is having a profound hearing loss, which is almost 90 decibels, 90 to 100 decibels, then aid will not be very helpful.
Okay.
Then we go for the cochlear implant. And cochlear implant is very costly surgery because the cochlear implant device itself, it cost almost 16 lakh to 20 lakhs. And it is not made in the Pakistan, it is usually made in the Denmark or Switzerland.
Okay.
And we import that. So for that you can consult, there are many centers in the Pakistan like CDA hospital in the Islamabad, and Beria town also is providing that facility, Sheikh Zayed hospital, and also many hospitals in the Sindh, Karachi, they are also providing this free facility of the cochlear implant,
that is so nice.
which is funded by the government. So I will advise the parents to consult the ENT specialist as early as possible.
And get the cochlear implant so they can speak
Yes.
and they can grow normally, right?
Because if you delay the process and your child is older than 5 years, then he will not develop the speech properly.
What about hearing loud noises for people who work with like machines in the factories or aeroplanes, or people who are, you know, constantly listening to blaring music in their car or on their headphones? What would you advise children about this?
This is one of the occupational hazards of the loud noises, and in the professional users, of the loud noises, we advise them to use the ear muffles. Okay, and in the children, the loudness intensity should not be increased. As in the mobiles or different devices, they mentioned that your volume is too much loud.
Yes.
That can damage your inner ear, so that should be avoided. And in the children's and the teenagers, I always advise the parents, first of all, don't use loud noises, and always give some break. At least after half hour, you should remove the headphones.
And especially the long-term use of the phone, because we're addicted to the phone and people tend to keep talking on the phone, and they're holding their neck like this and holding. So are these radiations really bad for the ear as well?
Causes the long-term uses can cause the inner ear damage.
Okay, so we've spoken a lot about the ear. Let's come to the nose now. So what are the problems with the nose? First of all, what are these growths inside the nose, the polyps, the adenoids, whatever, what is inside the nose?
In this season, very common, we are facing the patient with the sinusitis. Again, due to the humid environment and the sudden changes in the temperature, like you are going from the AC rooms to the humid environment outside, that can cause the flu symptoms, nasal blockage, and sinus issues also. So patient usually come to us with the nasal obstruction, the difficulty in the breathing from the nose, and anosmia, loss of smell,
and snoring as well.
Snoring and sneezing, and discharge from the nose, or discharge going back to the throat,
post-nasal,
which is a common sign of the sinusitis. And also sometimes patients are having headaches. If you are especially having the headaches and frontal headache, especially on bowing front, then it is the common sign of the sinusitis.
So sinusitis is when all these spaces around your face are, you know, full of this mucus or fluid, and it's giving you a headache, throbbing headache, and then you have these big dark circles which you keep applying creams and they won't go, and then you keep falling sick again and again. And they say, you know, there is no cure for it. Is there a cure for sinusitis, clogged sinuses? What should we do?
No, nowadays there are many cures for the sinusitis, especially we are nowadays having advanced surgeries, that is functional endoscopic sinus surgery, and which is very non-invasive surgery, and in that we open the sinus tracts inside the nose, and we can drain the fluids and the mucus from the sinuses. And it will also reduce the recurrent infections.
Exactly.
Previously, we don't have these facilities, endoscopic facilities for the nasal surgeries. That's why the sinusitis infections keep on coming. Yes, but nowadays we are having advanced technologies, and we can use them for.
So what is the role of taking steam? They say, you know, steam inhalation is very important. Take a lot of steam, improve your immunity with vitamin C and all of that. So does that also play a role?
Yes, that plays a role, and especially in the sinusitis, steam is very important. That causes the loss of the mucus retention in the sinuses, and you will feel better in the headaches. And along the steam, we advise the patient to use nasal sprays also, and improve your hydration.
Improve the hydration. And what about about cleaning the nose? As we in ablution before our namaz or our prayer, we always clean the nose and the nostrils. So how important is cleaning the nose, and what is the ideal way to, should we blow out the nose or should we not, or what is it?
No, blowing of nose is good for the nasal cleaning, and 3 times cleaning in the ablution is very good for your nasal health.
Okay.
But in the patients who are having recurrent sinusitis and we perform the surgeries like nasal surgeries, septal surgeries, or sinus surgeries on the patients, we advise them to clean the nose normally 4 to 5 times daily. And in that cleaning is different from normal ablution cleaning.
Okay.
In that, we advise the patient to use the feeding syringe, which is a 50 cc syringe, or there are nasal pumps also available in the market. And we advise the patient to use the saline water to clean the nose.
So you should use salt water to clean the nose.
Yes.
And for babies also, should we use that suction kind of thing to clean the nose or no?
If your baby is having too much mucus in the nose, then you can use that. But normally, steam is fine.
Okay. And what is a deviated nasal septum, DNS? And a lot of people, their whole life, they keep complaining, I have DNS, and then I snore, and when I snore, I keep my mouth open, and my dentition is also not okay. So there's so many linked problems. So what is a DNS, and how do you get rid of it?
Yes. DNS usually occurs during the childbirth or in the childhood when some child is hit by the ball or any trauma that can cause the deviated nasal septum. And it can also cause external deformity, cosmetic deformity, but usually it causes the nasal obstruction.
Right.
And most of the patient feels the blockage of the nose. There will be no other symptoms. There can be other symptoms, but sometimes there are no other symptoms like sneezing and post-nasal drip. Only the patient will complain about nasal blockage, nasal obstruction. And after thorough examination, we advise these patients the septoplasty surgery. If the patient is having DNS, many patients come to us who are having DNS and they doesn't complain about nasal obstruction. So in these cases, we doesn't advise surgeries.
So only if it is needed. And how long does this surgery take, and what is the?
It is a very simple surgery. It usually takes 30 minutes, and it is done under general anesthesia, and recovery time is almost 1 week.
What about growths in the nose? Like some people have polyps or something in the nose. So what is that, and how do we go about it? How do we diagnose it? How does it appear?
Polyps are basically caused by the allergy. And if the patient is having especially asthma and nasal allergies, these patients most commonly have the polyps. And in the polyps, we always advise the patient to continue to use the medicines.
Okay.
Because nasal polyps are just like the diabetes and hypertension.
Oh, okay.
That patient, yes. So patient needs to continue the medications for almost his life. Okay. And surgery is not the treatment for the polyps. First of all, we need to make sure that surgery is not the treatment. So we only perform the surgeries in the patients who are having too much nasal obstruction, who are having too much problems due to the sinusitis, or who are developing any kind of complications as like they are having eye infections or polyps are spreading to the brain. Then we advise the surgeries. But the treatment of the polyps is the medicines, nasal sprays.
What about epistaxis? A lot of children especially, they have their nose bleeding all the time. So what should we do about this nose bleed, and how do we stop it?
Epistaxis has many causes. In the children's, usually the chronic infection in the nose, rhinitis, or itching in the nose can lead to the epistaxis. In simple children's, we advise them to use any kind of the Vaselines or Polyfex or paraffin inside the nose. And there are many sprays available which they can use. If he or she is having too much infection inside the nose, then he should consult the ENT specialist, and he will advise you antibiotics also.
But how do you stop it immediately? Do you pinch the nose from here and keep them straight, or do you make them lie down, or do you put that cold water, ice? What is the mechanism to do it?
In the home, if any person is having the epistaxis, he should pinch the nose and clean it with the cold water.
Okay.
And cold water can cause the vasoconstriction, and it can reduce the bleeding. And pinch the nose from this part. You can use any kind of the handkerchief or any gauze piece to keep the nose, pinch the nose. And there are many sprays available over the counter you can use for the bleeding. And the other thing is very important, that you should also check your blood pressure. In the adults, especially 40 plus patient, you should always check your blood pressure, because hypertension is very common cause of
Exactly.
epistaxis.
What about foreign bodies in the nose? Because children keep to tend to suck up all these foreign bodies in their nose as well, beads especially. So what to do about that?
Foreign bodies are very common. In the last few days, I also got many foreign bodies in the nose, and most of the patient come. They say that mothers of the child, they say that there is too much smell coming out of the from the nose of the patient, and they are not aware that the baby is or child is having any foreign body in the ear, because child will put the nose foreign body inside the nose, and he will play around for the weeks, and after the 1 week 2 weeks there will be infection in the nose, and it will cause foul smelling, very much foul smelling. Then the parents will realize that there is something wrong with the child, and they will come to. So if your child is having smell, if you are feeling there is smell coming off the child nose, always consult the ENT body, because 99% there is a chance that there is a foreign body inside the
There
nose.
is a foreign body. Okay, Dr. Saab, what is the reason for this anosmia, the loss of smell? In COVID, we had a lot of loss of smell. Does it really come back? And if somebody starts getting complete loss of smell, what is the way to, get it back?
Anosmia, there can be a permanent loss, and there can be a temporary. And COVID patients, usually there was a temporary anosmia. And with the good use of the multivitamins, hydrations, and timely treatment, there was a recovery with the anosmia.
Okay.
But most of the patient, when they get the anosmia, that is usually a permanent anosmia. And sinusitis also, that also causes the temporary anosmia. And some kinds of sinusitis or nasal infection can also cause the altered anosmia, like change of the smell.
Okay. What about the throat? Now let's move into the throat. Every child almost is absent from school repeatedly due to tonsillitis. They keep falling sick again and again. Some have failure to thrive, and then they have to go for a tonsillectomy. What would you tell, or how would you describe these tonsils and the adenoids or whatever growths in the throat, and how do we go about it?
Tonsillitis, first of all, the history is very important. If the child is having the episodes of recurrent tonsillitis, tonsil infection, 5 to 7 episodes per year, then we advise the parents to go for the surgery, tonsil surgery. If the child is having like 2-3 episodes per year, and these episodes are not that much, that the child is absent from the school, he is taking again and again antibiotics, then he doesn't need to go for the tonsillectomies. But we advise the parents that they should give proper history of the child. If the child is having recurrent infection, like every month they are giving him antibiotics, so these antibiotics ultimately lead to the liver functions
and resistance as well.
Yes, resistance and they can also affect your stomach, these antibiotics, and they are also burden. The cost of burden is also increased. If you go for the tonsillectomy, that cost of burden will be reduced.
So it is. And what is the role of tonsils in our body? Is it actually playing a role in the immunity? Is there any harm in removing these tonsils? Are there any risk with the tonsillectomy procedure? How long does it take, and what are the precautions after it?
Tonsils have the functions of immunity in the first 3 years of the child. After the 3 years, their function is finished. And if the tonsils are the cause of the infection, if tonsils are causing recurrent infection, then they should be removed. And removal of tonsils does not affect your body. They does not affect any kind of immunity. In the long terms, removal of the tonsil doesn't cause any problems. After the removal of tonsils, the only complication which can develop is the bleeding from the throat. And this bleeding can occur within first week to 10 days. After that, the child will be normal.
What about adenoids? What are adenoids? How important is it to remove them, and where are they, and what are their symptoms?
Adenoids are the similarly structured like the tonsils behind the nose of the person, and they start developing by the 6 months of the child, and then up to 10 years. After the 10 years, the adenoids will regress by themselves. So in the child like 4 years, 5 years, if he is having the complaint of snoring, too much snoring, nasal blockage, and there is too much discharge from the nose, then we go for the adenoids. We first of all advise the parents x-rays. In the x-rays, if the adenoids are too much enlarged, hypertrophied, then we go for the adenoid surgery. And if they are not much enlarged, like medium size adenites, the steroid drops or nasal decongestants can reduce the size of the adenites also.
And what is the cause of hoarseness? Let us come to the voice hoarseness. How important is it to take care of our vocal cords, and what is the reason for this great hoarseness or nodules or whatsoever, and what is the treatment options?
Hoarseness have many causes, but common causes are vocal abuse and too much use of the voice, like professional voice users and like in the anchor
Like
persons,
us,
yes,
talking all the time,
and musicians,
right?
and singers and teachers especially, and the children who are doing hifz in the madrasas. These commonly come to us with the vocal nodules, and too much voice users are having these vocal nodules. And simple treatment of this vocal nodule is voice rest. If you do a voice rest for 1 week, absolute voice rest, means do
Stay
not talk.
silent?
Yeah, stay silent.
Okay.
Then they will reduce the vocal nodules.
Okay.
And if they doesn't reduce with the voice rest, then we go for the surgeries. And the other causes of the hoarseness are vocal cord palsies that can be due to any kind of the infarctions or nerve damage, and also smoking and
cancers as
cancers
well.
also, that can also lead to the hoarseness of the.
All right, thank you so much, Dr. Junaid. Now let us move to your other section where you're going to explain in detail how you actually examine the ear, nose and throat of a patient, and how visiting an ENT surgeon is different from visiting any quack, because he gets to see what is the problem and how he needs to go about it to treat it. So let's move ahead and see how he examines the patients. Dr. Junaid Shahzad will now explain to us how he examines the patient and what an otoscope is. So we are going to examine the ear first, Dr.
Yes.
Junaid?
Yes.
Okay, so how do we move forward?
First, whenever a patient arrives to our OPD, we take the history, a brief history. Is he having an ear problem, nose issues or throat issues? And then we examine 3 of them, because all of 3 are connected
to each
That's
other.
That's why in the ENT examination, the ear, nose, throat examination is very important.
Okay.
If the patient is having ear issues, then nose and throat should also be examined.
Always examine.
So first of all, in this patient, we will examine the ear, and now we are having the latest technologies, endoscopes. So in the endoscope, there is a facility that the patient can also
see what is happening.
Yes, what is happening.
Okay, so you've put a probe inside her ear,
yes.
and we can see it on the screen at the same time.
Yes.
So there we are going inside the ear.
This is the external part of the ear.
Okay.
And you can see this is a wax.
Right.
Okay, this wax is very important for the health of the ear.
Okay.
So we call that the healthy wax.
Ear.
And
Okay.
if the patient is using the cotton buds or anything, he will remove this layer, and it will attract the insects.
Oh.
So don't remove this.
Okay, so
wax.
what we think is cleaning is actually not
Yes,
cleaning.
Yes.
Okay.
But if the patient is having too much wax,
Yeah.
and the ear is blocked, so we whenever we enter this endoscope, we will see that wax.
Okay.
So in that case, the patient needs the cleaning. But
Okay.
in this is a
So
perfectly
this is the
normal.
eardrum?
Yes.
Is that the eardrum?
Yes. This is a perfectly
Okay.
normal, clean ear, and
Okay.
the eardrum is normal.
Normal.
And it is a shining eardrum, which is normal.
Okay.
Temperature.
So it is not inflamed,
No,
nothing.
no,
So this is
not
the way
inflamed.
you
Yes.
examine a ear, and this
Yes.
is the otoscope part of it.
Yes.
So now you're going to examine her
Yes.
nose.
Yes. And whenever we examine this ear, also we examine,
the other ear.
also.
Oh, right. Okay.
So after examination, we use these alcohol swabs to sterilize it.
Okay.
And
So it is very important to do
Yes.
it from a good place so that
Yes.
there is no cross
Yes.
infection.
yes.
Okay. So
Now
now
we
we are
will-
going to examine her nose.
Yes.
All right.
In the nose again, we look for any external deformity, anything like that,
Okay.
and then the patient or patient attendants can see what's inside the nose.
Okay.
Okay.
Okay. So this is a normal healthy nose.
Yes, this is a normal healthy use. There is mild swelling in the nose,
turbinates?
terminates
Okay.
hypertrophy.
Okay. So there's a mild swelling. Maybe
Yes.
probably
Yes.
she's sick with some.
No, this is
No.
not much sickness.
Okay.
As you can see, the other side is perfectly normal.
All right. So
You can
only
see.
the one side
One
is
side
slightly
so
swollen.
one side slightly swollen nose is sometimes normal.
Okay, so that's
sometime
normal.
if the patient is having nasal obstruction or any congestion in the nose, then we will advise her nasal drops or any medications.
So this one instrument serves as an
yes,
thing for otoscope and nose and
also. And
throat.
in this nasal examination, we can also see that if the patient is having deviated septum,
okay.
as we discussed before,
that
if the patient is having deviated septum, then there will be a blockage inside the nose, and the treatment for that is the surgery.
Okay. So the third part of this examination would be her throat
yes,
now.
Throat.
And
in the throat, we use two kinds of endoscope sometimes. This is a 0-degree endoscope for the examination of the general throat, and for the larynx, the voice issues, we use the other endoscope, which is 70-degree laryngoscope basically.
okay.
In
So you're going to disinfect it again,
yes,
and now we are going to see on the screen and
Yes.
your camera the throat of the patient. So in one sitting, they get examined actually for the ear, nose, and throat. And that would be the tongue depressor.
Tongue depressor, yes.
Okay. So we have moved ahead from the normal
Yes.
conventional tongue depressor only.
Yes.
Okay.
Open your mouth. See.
Okay.
Okay. So in this case, we doesn't touch anything with the endoscope. Just
okay.
we
You just probe it inside.
yes, and just see with the light.
Okay.
And you can
so she
see
has no tonsils.
there are
nothing.
no tonsils. Uvula is normal. Her tongue is normal. Dentitions and oral hygiene is good.
Good. Very good. Very, very.
Mm.
So this was a good patient and a normal patient who
Yes.
did not have any of these. Thank you. What else would you like to explain after this examination? How else do you examine? Like before we used to do this upper, outward and God knows what now. So do we do that, or do we see their swallowing and all that as well?
Yes. We see the swallowing. We see the R reflex also in the patient. And if also we examine the neck, if there is any problem in the neck, any swelling in the neck, like cervical lymph nodes, thyroid enlargement, or salivary glands enlargement, we also examine for the nose. And then if the patient is having vertigo, then we go for the vertigo test, the dizziness test.
All
also.
right. So Dr. Sir, what message would you give to our audience in terms of ear, nose and throat health? One concluding message as we end our program from you for our audience out there. You can advise them what they need to eat, how they need to take care of their ear, nose, throat, and how they need to visit an ENT surgeon and how regularly.
So we have discussed many things, but the important thing is that keep your hydration good, avoid cold water and cold drinks also, especially in this weather. And in this monsoon weather, avoid using cotton buds, and again use swimming plugs or anything like that while swimming. And humid environment is very good for the fungal infection, so always avoid anything putting inside your ears.
Thank you so much, Dr. Junaid Shahzad, and Dr. Junaid was with us during this program, and you heard it from him that to take care of your ears, nose and throat, it is very important what you put inside it. So apart from hearing good stuff also, it is very important that you don't stick in just almost everything from anywhere. Be very careful in this monsoon environment, and always visit a proper, licensed, educated ENT surgeon so that there are no permanent traumas to your hearing, to your smelling, or to your swallowing or speaking for that matter. Thank you so much for watching us. We'll meet you next week inshallah in program Health is Wealth. Thank you and Allah Hafiz.